Okay, so today we're doing a deep dive on something everyone knows, the common cold. I've got some really interesting information here from the Mayo Clinic. Should be pretty fascinating.
Yeah, it's always surprising to me how such a widespread thing can still knock us on our butts, a couple times a year.
Right. I mean, think about it. It's Monday morning, you wake up, you've got a little bit of a scratchy throat, maybe a sniffle, and bam, full-blown common cold. I mean, according to this, most adults get 2 to 3 colds every year.
Wow.
Kids in daycare even more. And if you smoke well, you're even more likely to catch a cold.
Really makes you think how many people are probably feeling those exact same symptoms right now.
Yeah. It's kind of wild when you think about it like that.
Yeah.
Okay, so let's break down those symptoms a little bit more. We've all been there. Runny nose, sore throat, and then, of course, you've got those sneezing fits.
Yeah.
And I don't know about you, but I always feel like I'm moving in slow motion when I have a cold.
Oh, yeah, for sure. I mean, that general malaise, that's a hallmark of a cold. Like your body's just saying, nope, I need a break.
Exactly. And, of course, you might have some mild aches and pains, maybe a headache, low-grade fever.
Mm-hmm.
And then there's the mucus. It always starts out clear. And then, a few days in, it turns thicker and yellow or green. I always thought that meant it was turning into a bacterial infection.
Yeah, a lot of people think that, but it's actually a good sign. It just means your immune system is doing its job.
Really?
Yeah. All those white blood cells are rushing to fight the virus, and some of them end up in the mucus. That's what gives it that yellow or greenish color. So it's actually a sign that your body is fighting back.
Oh. See, I always thought that was a bad thing, but that's good to know. So are there ever times when a cold might need a doctor's attention?
Yeah, good question. Most adults, a cold will clear up in a week to 10 days. But if you've got a fever higher than a 1 or 1.3, that lasts more than 3 days. Or if your symptoms are getting worse instead of better, it's probably time to call your doctor. And, of course, if you have difficulty breathing, like shortness of breath, wheezing, chest pain, that could be a sign that something more serious is going on.
Right.
Same with any intense pain. Really bad headache, earache, sinus pain. Those things are worth a call to the doctor.
Makes sense. So we know what the symptoms are, but what is it that's actually causing all this misery?
Well, despite its name, the common cold isn't caused by cold weather. It's actually a virus.
A virus? Wow. I mean, something so small it can bring us to our knees like that.
Yeah, there are actually over 200 different viruses that can cause a cold. But the most common one is called a rhinovirus.
Rhinovirus, huh? So how do these viruses get into our body? Is it just breathing the same air as someone who's sick?
Well, it's a bit more complicated than that. Viruses need to find their way into our cells to, replicate and spread. Like, think of our cells as tiny houses. And the viruses are looking for an unlocked door to get in. Those doors are our nose, eyes, and mouth. So if someone coughs or sneezes near you, those tiny virus particles, they can get launched into the air and land right on your face. And that gives them an opportunity to get inside.
So it's not just about being in the same room as someone who's sick. It's about these virus particles finding a way in. So those airborne droplets are a major culprit. What about touching things? Like, can you get a cold from shaking someone's hand or touching a doorknob?
Yeah, absolutely. Viruses can actually survive on surfaces for hours, even days sometimes.
Wow.
So you shake hands with someone who has a cold, touch the same doorknob, then, you rub your eye or touch your nose without thinking. That's it. That's how the virus gets in.
Right. So it's like a microscopic game of hide and seek, huh? We've got airborne droplets, contaminated surfaces. Is there anything else that we should be aware of?
Well, sharing is usually a good thing, but not when it comes to colds.
Right.
Sharing utensils, cups, toys, all that stuff can transmit the virus. It's like giving them a free ride from one person to the next.
Yeah. No more sharing drinks then. I got it.
Yeah. And even something as simple as touching your face after you've come into contact with the virus, that can do it. It's all about those entry points: mouth, eyes, and nose.
So is getting a cold just bad luck then? Or are there things we can do to reduce our risk?
Well, it's not all about luck. There are definitely some things that can make you more susceptible to catching a cold, and some of them are within our control.
Okay, that's good to know. So what are some of those risk factors?
Well, age is a big one. Infants and young children are the most vulnerable because their immune systems are still developing. They haven't had a chance to build up those defenses yet.
Right. Makes sense. I mean, my kids seem to bring home a new cold from daycare every other week, it seems.
Yeah, it's pretty common. What about adults, though?
Yeah. Are there certain things that make adults more likely to get sick?
Of course.
Yeah.
Having a weakened immune system, whether it's due to chronic illness or stress or lack of sleep, those can make you more susceptible.
So taking care of ourselves, getting enough rest, managing stress. That's actually part of cold prevention.
Exactly. And then there's time of year. We tend to see more colds in the fall and winter.
Oh, right. So is that because of the cold weather itself, or is it something else?
It's more about how we behave during those months. We're all cooped up indoors, more likely to be in close contact with each other.
Makes sense. So it's not the cold weather itself, it's just how we act when it's cold. What about smoking? Does that make a difference?
Oh yeah, smoking weakens your immune system, makes you more likely to get sick. Plus, it irritates your airways, which creates a perfect environment for viruses to thrive.
Right. So secondhand smoke is bad news too. What about crowds? I always hear that airplanes are basically just giant petri dishes.
Well, being in crowded places like schools, airplanes, malls, any place where there are a lot of people, it just increases your chances of encountering those cold-causing viruses.
So anytime you're around lots of people, your risk goes up.
Got it. Okay, so we've talked about what causes colds and the things that make us more vulnerable to them. But what can we actually do to prevent these things?
That's the good news. There are actually a lot of things we can do. They might seem simple, but they can really make a world of difference.
I'm ready. Let's hear it.
Well, it might sound like a broken record, but hand washing is really your best weapon against the common cold. Think about it. All the things you touch throughout the day. Doorknobs, elevator buttons, shopping carts, your phone. All those things can harbor cold viruses. And when you touch them, you pick up those viruses.
Okay, I know we've heard it a million times, but why is hand washing so important?
It's like those viruses are tiny ninjas, just waiting for their chance to strike. They only need a tiny opening, like a touch to your eye or a scratch of your nose, and then they get in and start replicating.
Yeah.
Hand washing is like washing those ninjas away before they have a chance to infiltrate.
Okay, so how do we do it right? I mean, we're not just talking about a quick rinse under the tap, right? Yeah, right. It's about using soap and scrubbing those ninjas away. Lather up your hands, get between your fingers under your nails. Really scrub for at least 20 seconds. That's about the time it takes to sing happy birthday twice.
Okay.
And if you can't get to soap and water, use an alcohol-based hand sanitizer. At least 60% alcohol.
Okay, so 20 seconds of vigorous scrubbing. Like, I'm really trying to get those ninjas off my hands.
Exactly.
What about cleaning and disinfecting surfaces? How important is that?
It's crucial,
Yeah.
especially in places where a lot of people touch the same surfaces.
Yeah.
Think about your office desk, kitchen counters, bathrooms, those high-touch areas.
Right.
Regularly cleaning those surfaces can really help prevent the spread of germs.
So if someone's sick in your house, you've got to be extra diligent about wiping things down.
Definitely.
Okay.
You want to make it a hostile environment for those viruses.
Got it. Okay, so we're washing our hands like ninjas are attacking us. We're wiping down every surface in sight. What else can we do?
Well, remember how cold spread through those airborne droplets from coughs and sneezes? That's where covering your mouth comes in. It's like putting up a shield to block those ninja viruses from getting launched into the air.
Right.
So always sneeze or cough into a tissue, and then throw that tissue away immediately.
Okay, and what if you don't have a tissue?
Well, the crook of your elbow. It's not ideal, but it's definitely better than nothing.
Okay, elbow it is. What about sharing drinks or utensils? Big no-no.
Definitely a no-no. It's like giving those viruses a direct path from one person to another.
So no more sharing forks, no more sharing drinks. Okay, I got it.
And avoiding contact with sick people is always a good idea. I mean, I know it's not always possible, but if you can keep your distance from someone who's sick, it can really help reduce your risk.
So if you're the one who's sick, do everyone a favor and stay home if you can.
Yeah. You'll recover faster, and you'll prevent those viruses from spreading.
So it's not just about protecting yourself, it's about protecting others. I like it. Okay, so we've covered the basics, but let's get a little bit more in depth. We know that colds are caused by these sneaky viruses, but why do they seem to hang around for so long? Why do we keep getting them year after year?
That's a great question. And the answer is, it's because these viruses are constantly evolving. They adapt to survive. It's like they're tiny little escape artists, always finding new ways to outsmart our immune system.
So it's like an ongoing arms race between our bodies and these viruses, huh?
Exactly. And remember, there were over 200 different cold viruses. So even if you developed immunity to one, there are still a lot of others out there.
It's like a game of whack-a-mole, huh? You get rid of one and another one pops up.
Yeah, that's a good way to put it. And to make matters worse, these viruses mutate, which means that their outer appearance actually changes.
Oh, wow. So our immune system might not even recognize them the next time around.
Right. It's like they put on a new disguise every time they infect us. It makes it harder for our immune system to identify them and neutralize them.
These viruses are sneaky, so is there anything we can do to combat that? Or are we just stuck in this endless cycle of getting sick?
Well, it's a tough battle,
Huh?
but there are definitely things we can do. And those prevention strategies we talked about earlier, those play a really big role.
So washing our hands, covering our coughs, all those things actually help slow down viral evolution.
Exactly. By reducing the spread of viruses, we're also limiting their opportunities to mutate and evolve.
It's like we're cutting off their supply lines, preventing them from amassing a bigger army.
Yeah, that's a good analogy.
So what about vaccines? I know we don't have a vaccine for the common cold yet, but do vaccines for other viruses play a role?
They do. Vaccines are a huge part of the fight against viral diseases. They work by giving our immune system a sneak peek at the virus without actually making us sick.
It's like giving our immune system a cheat sheet, helping them recognize and fight off the virus more effectively.
Yeah, it's like a training exercise for our immune system, preparing it for a real encounter with the virus.
And that's why vaccines have been so successful at eradicating or controlling so many infectious diseases, right?
Right. And as research continues, we may one day have a vaccine that targets multiple cold-causing viruses.
That would be amazing. So it sounds like even though colds might always be a part of life, we're not totally powerless against them.
Exactly. We can take steps to protect ourselves and support scientific advancements. And who knows, maybe one day we'll be able to outsmart those tiny escape artists.
Well, this has been really insightful. We've learned a lot, but there's one more thing I'm curious about. If these viruses are so good at evolving and adapting, why haven't they become more dangerous? I mean, why are colds still just colds and not something more serious?
That's a great question. And to answer it, we need to talk about something called viral fitness.
Viral fitness. I'm intrigued. Tell me more.
Well, it basically comes down to the virus's goal, which is to replicate and spread to as many hosts as possible. And becoming more deadly can actually work against that goal.
Really? So being too deadly isn't always the best strategy for a virus.
Right. Imagine two cold viruses. One that causes those mild symptoms we've been talking about, and another that's really nasty, makes people seriously ill.
Okay, I'm following you.
Well, the virus that causes mild symptoms, it's more likely to spread because people who have it are more likely to be out and about interacting with others.
Even though they feel kind of lousy.
Exactly.
Hmm.
But the virus that makes people really sick, they're more likely to stay home and isolate themselves, which limits the virus's ability to spread.
So in a way, being a milder virus is a better strategy for survival. It's like a stealth approach, flying under the radar.
Exactly. And that's where viral fitness comes in. It's all about how well a virus can replicate and transmit itself. And sometimes being less dangerous actually makes a virus more fit.
That's fascinating. So it's not always in a virus's best interest to become more deadly.
Right. It's about finding that balance between spreading efficiently and not killing off its host.
Wow, I never thought about it that way before. It's a really complex relationship between viruses and their hosts.
Yeah, it is.
And it also highlights how important those prevention strategies are, even for something as seemingly harmless as the common cold.
Absolutely. By slowing the spread of those viruses, we're not only protecting ourselves, but also helping to keep those viruses in check.
So it's not just about avoiding a few sniffles, it's about playing a role in public health.
Right.
Well, this has been a really eye-opening look at the common cold. We've talked about the symptoms, the causes, those risk factors, and prevention, and even the evolution of these viruses.
It's been quite a journey.
It has. But we've still got more to cover. In part 2 of our deep dive, we'll explore some potential complications from the common cold. And we'll talk about whether those natural remedies actually work.
Looking forward to it.
I am too. So join us next time as we continue to uncover the mysteries of the common cold.
Sounds good.
Welcome back to our deep dive on the common cold. I'm still thinking about that viral fitness concept we talked about. It's pretty amazing how those viruses have survival strategies, just like, any other living thing.
Yeah, it really shows how powerful evolution is, even at the microscopic level.
Absolutely. So we talked about how most colds are just, a minor inconvenience, but sometimes things can get a little bit more complicated.
Right. Most colds do clear up on their own, but they can lead to other problems, especially if you have a weakened immune system.
Okay, so what kind of complications are we talking about here?
Well, one thing that can happen is a middle ear infection. That's called otitis media. It happens when the eustachian tube, the one that connects the middle ear to the back of the throat, gets blocked with fluid.
And that's more likely to happen when you have a cold because of all the inflammation and mucus.
Exactly. It creates this kind of breeding ground for bacteria, grow in the middle ear. And those ear infections can be really painful, especially for kids.
So if you have a kid, what are some signs that you should be looking out for?
The most obvious one is ear pain. But you might also see a fever come back after the cold seemed like it was getting better, or even some drainage from the ear. And kids, they might get fussier, have trouble sleeping, or tug at their ears.
So if you see any of those signs, call the doctor right away.
Yeah, absolutely. Treating it early with antibiotics can usually clear it up pretty quickly and prevent those long-term complications.
Good to know. Okay, so middle ear infections. Are there any other complications we should be aware of?
Yeah, colds can trigger asthma symptoms or make them worse if you already have asthma. So that can cause wheezing, coughing, shortness of breath.
So if you're someone with asthma, you need to be extra careful if you get a cold.
Definitely. And make sure you've got your rescue inhaler on hand and, follow your asthma action plan.
Okay, so asthma. Anything else?
Well, sinusitis is another possibility.
Sinusitis. That's just a sinus infection, right?
Yeah, basically. It's when those air-filled cavities in your skull, your sinuses, get inflamed and filled with mucus.
Oh, I've had that before. It's awful. It's like a constant headache.
Yeah, it's no fun. And, colds make it easier for bacteria and viruses to get in there.
Okay, so what are the symptoms of sinusitis?
Well, you might notice some thick, discolored mucus, that drainage, and then facial pain, pressure, maybe even a reduced sense of smell.
So if you're having those symptoms, definitely go see a doctor.
Yeah, they can determine if you need antibiotics or some other treatment.
Okay, so ear infections, asthma, sinusitis. Anything else?
There are some more serious complications, but they're a lot less common. Bronchitis and pneumonia.
Oh, that sounds scary. Are those things more common in people who have weaker immune systems?
Yeah, they are. Bronchitis is an inflammation of the bronchial tubes. Those are the airways that carry air to and from your lungs.
Okay.
And pneumonia is an infection of the lungs, which can be caused by bacteria, viruses, or even fungi.
So those are definitely things to look out for. But most of the time, people recover from a cold without any problems, right?
Right, yeah. For most people, it's just a temporary thing. But you should definitely know about those possible complications.
Good to know. Okay, so let's shift gears a little bit and talk about those natural remedies we mentioned before. Vitamin C, echinacea, do those things actually work?
The research on them is still a little iffy. Some studies show that taking vitamin C regularly can shorten the length of a cold a little bit, but it doesn't really seem to prevent colds altogether.
So it's not a magic bullet.
Right. And echinacea, the studies on that are even less clear. Some say it helps a little, some say it doesn't do anything.
Okay, and what about zinc? We talked about that briefly before. What's the deal with zinc?
Well, zinc is a mineral that's important for immune function. There are some studies that show that taking zinc supplements, specifically zinc acetate or zinc gluconate lozenges, if you take those within 24 hours of your symptoms starting, they might help reduce how long your cold lasts.
So it might help you get over the cold faster.
That's the idea.
Yeah.
But the research is still pretty mixed on that. And there can be side effects too, especially if you use zinc nasal sprays.
Right, we talked about those side effects before. Nausea, that bad taste, and even losing your sense of smell with those nasal sprays.
Yeah, so nasal sprays are probably best to avoid. The important thing is if you are thinking about using zinc, you should talk to your doctor first.
To make sure it's safe for you.
Exactly. They can figure out the right dose and form for you too.
Good advice. So zinc's a maybe, but it's not for everyone. What about the over-the-counter cold medicines? Are any of those worth trying?
Well, there's no cure for the common cold, unfortunately. Most of those over-the-counter medications just treat the symptoms. They don't actually get rid of the virus.
So they just help you feel a little less miserable while you wait it out.
Exactly. But they can have side effects, so it's important to use them carefully. Especially for kids. Always check with your doctor before giving any over-the-counter meds to kids.
Right. Always good to double check. So no magic cure in a bottle. But what about just making yourself more comfortable while you're sick? I mean, what can you do to feel better?
Yeah, comfort care is key when you have a cold. Even though we can't cure it, we can at least try to feel better. First of all, rest. Listen to your body, stay home from work or school if you can, and just let yourself recover.
Sometimes the best thing you can do is just curl up on the couch with a good book or a movie.
Yeah, exactly. And staying hydrated is super important. Drink plenty of fluids, especially water.
Okay.
Juice and broth are good too. Warm liquids like tea can really help soothe a sore throat.
Okay. And for those stuffy noses.
A humidifier can help with that. It adds moisture to the air, which can loosen up that mucus and make it easier to breathe.
And saline nasal sprays, those can help too, right?
Yeah, those can help clear out your nasal passages. And if you have a cough, Honey can actually work as a cough suppressant, especially for kids over a year old.
Really?
I know it sounds kind of strange, but
Uh-huh.
studies have shown that it can be just as effective as some over-the-counter cough medicines. Just remember, don't give honey to babies under a year old.
Right. Botulism risk.
Yeah.
What else?
Gargling with warm salt water can help the sore throat. And if you have aches and pains or a fever, over-the-counter pain relievers like acetaminophen or ibuprofen can help with that.
So basically lots of rest, lots of fluids, and treat those symptoms as they come up.
Exactly. And don't underestimate the power of chicken soup.
Oh, yeah. Chicken soup. Can't go wrong with that. Is there actually any science behind that, or is it just an old wives' tale?
There is some science to it. It might have some anti-inflammatory properties that could help with congestion.
So Grandma was right after all.
Plus, it's a good source of fluids and electrolytes, which is important when you're sick.
Sold. Okay, so we've talked about easing symptoms, but how long does this whole thing usually last? When can you expect to start feeling like yourself again?
Most colds last about 7 to 10 days. The first few days are usually the worst. The symptoms usually peak around day 3 or 4.
So that's when that blah feeling and the congestion and the sore throat are at their worst.
Right. But after that, you should start to feel better gradually. You might still have a little cough or some congestion.
But the worst is over.
Right.
Okay, so if it's been more than a week and you're still not feeling better, that's when you should call your doctor.
Yeah, definitely. It could be that something else is going on.
Okay, good advice. Well, I think we've covered a lot in this part of our deep dive. We've talked about the possible complications from a cold. We've looked at natural remedies and how to feel better when you are sick.
Yeah, we've gone through a lot of information.
But there's one more thing I'm wondering about. We've talked about how these viruses are evolving all the time and how that's one reason why we keep getting colds. But what about our own immune systems? Don't they learn and adapt too?
Yeah, that's a great question. And it brings us to, the amazing world of immunity, how our bodies remember past encounters with those viruses.
Okay, I'm ready. Tell me everything.
Well, every time you get sick with a cold, your immune system creates this defense against that specific virus. It starts producing antibodies, which are like little soldiers that target and neutralize the virus.
So our body is making an army to fight off those invaders.
Exactly. And the cool part is your immune system can actually remember. It keeps a record of those past encounters and how to fight them off.
So if you get exposed to that same virus again, your immune system's ready.
Right. It can recognize the virus and launch a faster immune response. And that means you might not even get sick at all. Or if you do, the symptoms are much milder.
Wow, that is really cool. So even though we get colds, our immune system is getting smarter and stronger.
Exactly.
That's good to know. So colds are actually kind of helping us in a way.
That's one way to look at it.
Okay, well, this has been another really interesting part of our deep dive on the common cold. We've learned about the complications, natural remedies, and even how our immune system learns and adapts. In part 3, we'll explore the world of immunity in even more detail. We'll talk about vaccines, the different types of immunity, and what happens when our immune system doesn't work the way it should. Welcome back to the deep dive. We've been talking all about the common cold. And last time we were talking about how our immune system is always learning and adapting, even when we're fighting off those pesky viruses.
Yeah, it's pretty amazing how it works. Always trying to keep us healthy.
Right. So let's dig into this whole immunity thing a little bit more. We talked about how our immune system remembers those past encounters with viruses, almost like it's building a library of viral mugshots or something.
Yeah, I like that analogy. And it's that memory that helps us fight those infections more effectively, the next time they come around.
So is that why some people seem to get sick all the time and others hardly ever do? Is it all about how good their immune system memory is?
Well, that's part of it for sure. Everybody's immune system is different. It depends on your genes, your environment, your overall health, even your past exposures to different bugs.
So some people just naturally have a stronger immune system than others.
Yeah. And that's where vaccines can really help. They basically give your immune system a sneak peek at the virus without actually making you sick.
So it's like a wanted poster for your immune system.
Right. So instead of getting hit with the full-blown virus, you're exposed to a weaker or inactive version, or maybe even just a piece of it.
So it's like a training exercise, getting your immune system ready for the real deal.
Exactly. And then if and when you do encounter that virus, your immune system is ready to go. It can fight it off a lot faster.
So you might not get sick at all. Or if you do, it's not as bad.
Right.
It's like a shortcut to immunity.
Yeah. And that's why vaccines have been so successful at preventing so many diseases.
It's amazing what science can do. So are there different types of immunity? Like, are they all created equal?
That's a good question. The type we've been talking about, the kind you get from exposure or a vaccine, that's called active immunity.
Active immunity, okay.
Yeah, it's like your immune system earning its stripes.
Right. Learning from experience.
Right, exactly. But there's another type called passive immunity.
Passive immunity, okay, what's that?
Well, it's when you get antibodies from somewhere else instead of making them yourself.
So it's like borrowing someone else's immune system.
Yeah, kind of. Like babies get antibodies from their mothers through the placenta during pregnancy, and then through breast milk after they're born.
Oh, right. I remember hearing about that.
It gives them protection while their own immune system is still developing.
That's pretty cool how that works. So active immunity is the kind you build up yourself, and passive immunity is the kind you get from someone else.
Exactly.
Okay, so both are important for staying healthy. What happens if your immune system isn't working the way it should?
Well, that can lead to some problems, like autoimmune diseases or immune deficiencies.
Autoimmune diseases, what are those?
They happen when your immune system attacks your own body instead of protecting it.
Oh, wow. So it's like your immune system has turned against you.
Yeah, it's not really clear why that happens,
Yeah.
but it seems to be a combination of genetics and environmental factors.
So are there different kinds of autoimmune diseases?
There are a lot, actually, over 80, and they can affect pretty much any part of the body.
Wow, 80 different kinds. Can you give me some examples?
Sure. Rheumatoid arthritis, it affects the joints. Type 1 diabetes affects the pancreas. And then there's lupus, which can attack different organs.
Wow. So what about immune deficiencies?
Well, that's when your immune system is weakened, so it can't fight off infections as well.
So it's like your immune system is running on low power.
Yeah, something like that. You can be born with an immune deficiency, or you can develop one later in life.
Okay. So what are some things that can cause that?
Well, some medical treatments,
Mm.
like chemotherapy for cancer, that can weaken the immune system. And then some infections, like HIV, they actually attack the immune system directly.
So it's either suppressed for medical reasons or it's being attacked by a virus.
Right. And people with weakened immune systems, they're more likely to get infections, including colds.
That makes sense. It's harder for their body to fight those viruses off.
Exactly. So it's really important for people with weaker immune systems to take extra precautions, to protect themselves from getting sick.
So washing your hands a lot, avoiding people who are sick, getting all their vaccines.
All that good stuff.
Well, this has been another really interesting part of our deep dive into the common cold. We've covered so much ground. We started with symptoms and causes, then we talked about prevention and treatment, and now we've even explored the amazing world of our immune system.
Yeah, we've really gone deep.
We have. And I'm still amazed by how something as simple as a cold can teach us so much about our bodies and the world around us.
It's true. There's always more to learn.
Exactly. Well, that's all the time we have for today's deep dive. A huge thank you to you for sharing your expertise with us. And to everyone listening, thanks for joining us. We'll see you next time on The Deep Dive.